Hi, I'm Karen McCall. I'm the Chief Operating Officer and the Chief Nursing Executive here at Windsor Regional Hospital. And I'd like to take a few minutes just to walk our way through one of the most significant issues that we're facing as an organization, and it's that called patient flow. We used to look at patient flow as a series of wait times, and we used to look at data. How long did patients wait in the ED for a bed? How long did they wait to see a doctor? How long did they wait to get an MRI? How long did they wait to get results? And our whole focus was on waiting. And now we look at an organization, at patient flow, and we challenge ourselves to say, we will not waste a day of your life. So what we've done with that thought process is made a number of changes within our organization. What you're going to be hearing about shortly is how we're using assessment bays to make certain patients that are admitted from the ED get to a bed as quickly as possible. Once again, the whole idea being, and our commitment being, we will not waste a day of your life.
So a patient's journey begins as soon as the decision to admission is made. We start looking for the appropriate inpatient bed as quickly as possible. Research supports, and we know, that the longer a patient stays in the emergency department, their overall length of stay can be lengthened. We also know that they are at greater risk for harm when they stay in the emergency department and also have a risk for deconditioning, which overall puts an added stress on the resources for our organization and for the hospital. So the goal is for all of us to work together and pull the patients as quickly as possible out of the emergency department. So once a patient is admitted, the emergency department notifies the command center, where the command center nurse starts to look for the appropriate unit for that patient where their treatment plan will continue. We have the assessment bays on our medicine units that help us to pull those patients out quickly and as soon as possible while their bed on the unit is being prepared for them. And this allows us then to work together and again pull those patients out as fast as possible.
When the command center gets a call from ED, we make sure to get all the required information about the patient and their care needs. Right away, we start looking for the most appropriate assessment bay to place the patient in based on his or her specific care needs. The command center is able to see what's happening throughout the entire hospital, which beds and bays are open, as well as occupancy details. Our role is to plan how to get the patient into the most appropriate bed on the right unit as quickly as possible. Once we find the right bed for this patient, we then call the RP on that unit to let them know. When we receive the call that we are getting a new patient, it is our responsibility to obtain a mobility status to determine how the patient transports and if a wheelchair or stretcher is required. It is also our responsibility to move the patient to the assessment bay as quickly and safely as possible by physically going down to the emergency department to pick up the patient and have a face-to-face conversation with the ED nurse to do the transfer of accountability. This in-person report is best practice. After handoff occurs, the RP, or designated nurse, introduces themselves to the patient and their loved ones and provides an explanation of the assessment bay.
Hi Austin, how are you?
Not too bad.
That's good. My name's Melissa. I work on Short Stay Unit 5 North. I will be bringing you up to the assessment bay, which is our extension of the emergency department. In that room, you'll be seen by your physician, by the pharmacist, OT, PT, whomever you need to be seen to.
Okay.
And we will move you to the other side once the bed's available.
Okay.
All right, you ready to go? You got your personal belongings?
I do.
All right, let's go.
Patients are brought to the assessment bay on wheelchairs or stretchers where a rapid assessment takes place to review and confirm the patient's diagnosis and develop the patient's plan of care. The bays are gender and IPAC neutral. Signs posted in the area help patients and their families understand the nature and purpose of the assessment bay. After arrival in the assessment bay, they will be assessed by the most responsible physician.
Hi, Mr. Jones. I'm Dr. Susky. How are you?
Not too bad, not too bad.
Nice to meet you.
Sitting here.
So we have a new system at Windsor Regional Hospital, and you're in what we call the assessment bay.
Okay.
The assessment bay is where we welcome patients to the hospital, and it's our way of getting things going a bit quicker. So it gets you out of the emergency room faster.
Okay.
And in the assessment bay, we encourage mobility. We don't want you to get rusty while you're here. And so we have you on a stretcher. That also facilitates getting testing done so that we're not transferring you from stretcher to bed frequently throughout the day.
Okay.
The nice thing about the assessment bay is that we do get prioritization for testing, and so we can get things done a bit faster to help get you through the system a little bit more quickly. All right. Once a decision is made that you need to stay in the hospital, we will then move you from the assessment bay into a full hospital bed.
Okay.
So your stay here shouldn't exceed 24 hours. Okay?
Okay. Thank
Great.
you.
So, if you don't mind, I'd like to take your history.
By facilitating efficient patient flow, the assessment bays allow us to reduce the length of time a patient waits in the emergency department for an inpatient bed, which in turn helps to reduce the length of time a patient needs to stay in hospital. This allows us to keep our commitment to our patients that we will not waste a day of your life while we provide them with outstanding care. No exceptions.